Talk, Dental Health Information Speech, sponsored by dentistnepal.com. Dental clinicians are around different places of Nepal, including major cities. If you need your dentist, please visit dentistnepal.com to find your dentist according to your dental problems. We are always at your service to educate you, to help you.
Namaste, this is Dental Tree Nepal, a platform to know more about dentistry and to meet dentists in Nepal. I am Dr. Gurung, a dental surgeon based on All Smile Dental Home, Kathmandu, Nepal. My NMC number is 15452. Today, I am going to talk about tooth extractions, its consequences, and scenario in our part of the world. First of all, let's start. Taking out your tooth with untrained manpower is always worse than taking it out with the registered dentist. With this note, let's start. Let's start with the biology of the tooth. Tooth is supplied with blood vessels, with nerves, and is wrapped firmly with the gums inside the bone. The growth factors or the necessary minerals are provided by the blood vessels and other vehicles, and the sense of the tooth, that is sensitivity, is generated by the nerve that supplies the tooth. In this part of the world, people tend to extract their teeth with little bit of pain, little bit of uncomfortable, and little bit of decay in their tooth to get lifelong relief from it. But that may not always happen because there are many other teeth in our oral cavity, and if you don't love your teeth, if you don't care your teeth, then the other teeth may get decayed or pain may arise in other tooth as well. So the extraction is not always the best solution for your tooth pain. Okay, then let's talk when the tooth becomes useless and when to extract it. Number one, when the tooth is fractured so extensively that it cannot be salvaged, then you have to knock it out or you have to take out your tooth. Or number two, when the decay is so extensive, the decayed part is reached way below the gum level and it cannot be restored by the restoration and endodontic treatment, then you have to extract your teeth. And for the third molars, when there is irritation, there is infection, or there is pericoronitis, that is inflammation at the back side of your jaw, that is at the third molar or wisdom teeth area, then you have to extract the tooth. There was a time in this part of the world, many years back, the dentistry was not so advanced. The common people, the untrained people in village, in rural areas, used to take out the teeth with common pliers as well.
Talk, Dental Health Information Speech, sponsored by dentistnepal.com. Dental clinicians are around different places of Nepal, including major cities. If you need your dentist, please visit dentistnepal.com to find your dentist according to your dental problems. We are always at your service to educate you, to help you.
But the society has changed, the time has changed drastically. The lifestyle, the fooding habit, and the stress and the responsibilities of the common people has changed a lot. So has changed the disease prevailed within them, like hypertension, that is high blood pressure, diabetes mellitus, that is high glucose level in the blood, and many other heart diseases kidney diseases, liver disease, and many other systemic diseases. And what we have to know is these diseases will directly or indirectly affect during the extraction of the tooth as well. With all these systemic diseases, people have become more complicated than ever. So, taking out your teeth should not be taken so lightly. So, when you go for taking out your teeth, first of all, don't tend to overlook a person who is taking out your teeth. Because as I already said, more lifestyle diseases, more systemic diseases have made a person more complicated than ever. And this is not the time that people use to extract tooth from untrained person in villages and remote areas with common medical aids. The life has changed a lot. The person who is extracting your teeth or who is knocking out or who is taking out your tooth must be Nepal Medical Council registered dental surgeon. You have to know who the dentists are who have registered in Nepal Medical Council. They have passed many series of examinations in the dental school and couple of examinations taken by Nepal Medical Council to provide licensing exam for the practice of dentistry in Nepal. So they are capable enough to take your teeth out from the oral cavity. As I already said, it is the complicated network in the oral cavity. You may think and ask, what will happen when we take out the teeth? My uncle did it with untrained person. My friend did not have any complications. My brother has done extraction in the village with limited aids. But you have to always take in mind that complication will not happen now and then, will not happen always. Mother Nature is so strong that she will save you. But what if the next complication is for you? What is the next person who will get complicated after extraction of teeth is you? So be aware what all may happen if you have bleeding disorder and your tooth is being knocked out or extracted by an untrained person. What will you do if there is profuse bleeding from the extraction site due to your systemic condition and other systemic diseases? Patient may get fainted while extracting the tooth. This may happen due to less blood supply to the brain. Some psychological accident may happen during extracting the tooth, like anxiety and restlessness. There can be other reasons as well. If the tooth root get fractured and need a surgery to extract it. What if your large vessels at the corner of your mouth get ruptured and bleeding starts profusely? And sometimes the nerve that supplies the mandible or the lips get snapped or cut off. What will be the consequences at this scenario when you are in untrained person's care? Common people knows less about this structure. It is like the circuitry of a radio that is open in front of you. So to know these complicated things, you must visit to a registered dental surgeons who are more aware in this situation. So you are advised to go to the trained manpower, to register manpower who has a degree in that particular field. Think twice before suffering a damages that cannot be altered. Taking out of your teeth is very dangerous and can be life-threatening sometimes. It cannot be always, it cannot be everyone, it cannot be every day, but what if the one is you? Just your bad day, just your bad luck. So be aware on time. Thank you.
Dentalk, Dental Health Information Speech, sponsored by dentistnepal.com. Dental clinicians are around different places of Nepal, including major cities. If you need your dentist, please visit dentistnepal.com to find your dentist according to your dental problems. We are always at your service to educate you, to help you.